Pathology amyloidosis. All right, so amyloidosis is somewhat of a confusing topic because it really isn't something that we can kind of pinpoint as to what's really going on. It is just the deposition of proteins in an abnormal way. So we have like these misfolded proteins that are going to be deposited throughout the body, and they cause a plethora of issues throughout all organs, depending on what organ it is found in. And there's different types in which they're located. But I'm just going to keep it simple. I'm going to focus on the high-yield things that you need to know about amyloidosis, and then we can move forward. So the first thing you have to know is that amyloidosis cannot be removed, okay? That's the first thing that we need to get out of the way. You cannot remove them. These misfolded extracellular abnormal proteins, usually beta-pleated sheets, they cannot be removed, okay? Now, the types of areas that they go in is renal, okay? So at the kidneys, you can cause nephrotic syndrome, cardiac, which causes restrictive cardiomyopathy, okay? Among a plethora of other things, neurological, right, which can be seen for patients that have Alzheimer's disease. But let's just focus in on just the overview. When we have amyloid deposition, we're going to be visualizing it via Congo red stain, okay, on non-polarized light, and apple green bifurcations on polarized light, okay? If you ever see the words Congo red staining, apple green bifurcations, amorphous pink material, they're talking about amyloid. I never understood that. I wish someone told me off rip what the hell they were talking about. So you have to know that. If you see amorphous pink material, Congo red staining, apple green bifurcations, they're talking about amyloids. They're talking about amyloid deposition. Okay. Now, moving on to the types of amyloid. Primary amyloidosis, secondary amyloidosis, transthreatened amyloidosis, and dialysis-related amyloidosis are known as a systemic, common type as systemic, okay? Do you need to know this? Not necessarily. It really isn't that big of a deal. But what I will tell you is the type of pathology associated with it is going to be a big deal. So for plasma cell dyscrasias, for example, multiple myeloma, the amyloid deposit associated with it is Ig light chains. And we'll talk about that later, but they're known as Bench-Jones proteins, okay? And those are Ig light chains, and that is primary amyloidosis, okay? Now, what you need to know, if you see multiple myeloma, think about Bench-Jones proteins. Those are Ig light chains, and they're found in the kidneys, okay? Associated with multiple myeloma, boom. Next, secondary amyloidosis is going to be our mainly associated with chronic inflammatory conditions, okay? Now, they don't really talk about these that much, so I'm not going to spend too much time on it. If you see rheumatic arthritis or irritable bowel disease, then start thinking about secondary amyloidosis, but they rarely ask about it, so I'm just going to skip over it. So number one, most important already, we talked about multiple myeloma. Cool. Secondary, we didn't really care that much about. Next is transthreatened. Transthreatened is going to be seen, or transthyretin, sorry, but we're going to be seeing it in patients with the cardiomyopathy, okay? So if there's restrictive cardiomyopathy, they ask you a question on it, and they're asking what type of amyloid is located, or if they give you transthreatened protein, then you know you're dealing with amyloid deposits for the heart, and it's causing that restrictive cardiomyopathy, all right? Next is dialysis-related amyloidosis. Cool. Seen in patients with end-stage renal disease that are on long-term dialysis, right? So what is associated with it? Beta-2 microglobulin, all right? So beta-2 microglobulin, what you need to know about it is that it can deposit in the joints, and it's a component of MHC class 1, which is seen in immuno. And we're going to talk about immuno a lot later, but just know that MHC class 1, MHC1, okay, a portion of that is made of beta-2 microglobulin, which is also seen in dialysis-related amyloidosis, all right? So to keep this simple, so far, what I care about is primary amyloidosis is light chain, Ig light chain, which is seen in multiple myeloma. Transthreatened, okay, is seen with restrictive cardiomyopathy. Beta-2 microglobulin, seen in dialysis-related amyloidosis for end-stage renal disease patients, as well as a component of MHC1. All right? Thus far, that's the most important thing. Moving on, we're going to talk about the localized amyloidosis, okay? First off is Alzheimer's disease. We've all heard of it before, and it's going to have beta amyloid protein. Okay, that's what the type of protein that's going to be built up, okay? And it's cleaved from amyloid precursor protein, which is found on chromosome 21. So that's why patients that have Down syndrome have an increased risk for Alzheimer's disease, because they have 3 chromosome 21s, leading to the increased cleaving of amyloid precursor protein, leading to that potential increase in beta amyloid protein. All right, we'll talk about it later on in neuros, but that's what you need to know for Alzheimer's disease is that beta amyloid protein. Okay. And lastly, the only thing that I really care much about that they might ask you about is type 2 diabetes is a type of amyloidosis. Okay. And that's going to be islet amyloid polypeptide. Okay, that's really all that you need to know. And lastly, medullary thyroid cancer. If you see anything with calcitonin involved with the endocrine system, and we're going to talk about it later on in the endocrine chapter, then we know we're dealing with medullary thyroid cancer for amyloidosis. All right, so quick overview. Amyloidosis cannot be removed because they are extracellular deposits of abnormally formed protein, usually in a beta-pleated sheet formation, okay? The kidney's most likely involved, and if you ever see Congo red stain, apple green bifurcations, or amorphous material, pink, they're talking about amyloid deposits. Primary amyloidosis is seen with multiple myeloma, and they have Ig light chains, also known as Bench-Jones, right? Next is transthyretin, okay, amyloidosis, usually seen in restrictive cardiomyopathy, lower yield. Next, dialysis-related amyloidosis has beta-2 microglobulin proteins, which is going to be depositing in the joints, seen in end-stage renal disease patients on long-term dialysis, and it also is a component of MHC class 1. Then going on to localized Alzheimer's, we see beta amyloid protein, which comes from the cleavage of amyloid precursor protein from chromosome 21. So that's why we have an increased risk with Down's patients. Type 2 diabetes is amyloidosis, so that's all you need to know. And then medullary thyroid cancer is also associated with amyloidosis with calcitonin. That's all. If you need help with it, let me know.